This is the briefing on the Washington State man who died of the coronavirus.
She said in that conference could be a problem. On the other hand, you can have a situation where we have a lot of people who are compromised and they need the ICU.
What is the first confirmed death here in the United States from coronavirus say about how this virus is spreading?
We don't know for sure how it's spreading. We know it's spreading beyond people who've been to China or.
Zeke, let me interrupt for a moment because they're having a news conference in Washington State providing more details on the first confirmed death. Let's listen in.
Who is our health officer for Public Health Seattle-King County, Dr. Kathy Lofi, who is the Washington State health officer, Dr. Frank Rito, who is the medical director of infection control at Evergreen Health Hospital, Dr. David Knopfler from Overlake Medical Center, and our King County Executive Dow Constantine. So with that, I'll turn it over to Dr. Duchin for the initial update.
Thank you, Patty. Thank you for joining us this afternoon. Today, Public Health Seattle-King County is announcing 3 new presumptive positive cases of novel coronavirus, COVID-19, including 1 person who died. And I want to just start by expressing our deep and sincere condolences to the family members and loved ones of the person who died. 2 of the confirmed cases are associated with Life Care Nursing Facility. It's a long-term care facility in Kirkland, Washington. 1 is a healthcare worker from Life Care. She's a woman in her 40s. She's in satisfactory condition at Overlake Hospital, and she has no known travel outside of the U.S. The second case is a woman in her 70s, a resident at Life Care, the long-term care facility, and is in serious condition at Evergreen Hospital. In addition, we're aware of a number of individuals associated with the long-term care facility who are reportedly ill with respiratory symptoms or pneumonia, and we're in the process of investigating this situation as an outbreak. We're in the beginning stages of our investigation, and new details and information will emerge over the next days and weeks, and we'll keep you updated. The person who died was a patient at Evergreen Hospital who had underlying health conditions. It was a male in his 50s. He was not a resident of the long-term care facility. We are now in the process of working with the long-term care facility with the support of the Centers for Disease Control and Prevention. Our CDC colleagues are coming out. We have a team arriving tonight. We'll have additional help on the ground from the CDC tomorrow. And we're in the process of providing support to that facility to care for the infected patients, to protect the uninfected patients, and to provide infection control guidance for their staff. At this point, I'm going to stop and turn the podium over to Dr. Kathy Lofi, who is our state health officer. Actually, before I do that, Kathy, let me just remind people a couple of things. First of all, novel coronavirus infection, as has been recognized, is spreading globally. And we are having increasing cases in the United States, and we expect to see increasing cases locally. It's very important for everyone to remember that 80% of the cases are mild. Patients frequently don't even need to seek health care. You can think of it as a bad influenza-like infection. However, as these recent cases demonstrate, it can be severe. And we want people to understand that there are things that they can do to protect themselves from getting this infection, just as we can do things to protect ourselves from getting influenza. Hand washing, more hand washing, less face touching, staying away from others who are ill. Please don't go to work or school if you yourself are ill. We can think about what might happen if we see more cases, which would mean possibly telecommuting, businesses having fewer people coming into work, either because they're sick or they're trying to minimize face-to-face interactions, social distancing that we will recommend so that people put more space between them and others so they're not likely to get sneezed or coughed upon. So there may be times when we would ask people to avoid going to large gatherings, to avoid congregating in public settings like sporting events, social events, and so on. But at this point, we do not have widespread community-wide transmission locally. We have transmission that's associated with an outbreak at this long-term care facility. So we're going to be watching the situation very closely, and we're going to be providing guidance as we learn more. At this point, I would say everyone should take the basic precautions: hand washing, more hand washing, less face touching, social distancing, not going to work or school when you're sick, staying home when you're ill, thinking ahead as to what might happen if people in your family become ill, how you'll care for them, If children are dismissed from school, who can watch them? If you've got people in your home who are older or vulnerable, how you'll take care of them if we have social distancing and people are requested not to go out frequently. Have medications in your home so you don't have to go out and refill a prescription if you don't need to. Have some foods that you like to eat handy so you don't have to go to the store if you don't have to go out and be interacting with other people and touching other surfaces. And finally, it's really important to know that as with seasonal influenza, the people who are at greatest risk for novel coronavirus infection with serious outcomes are elderly. So we will say, as we do with influenza, over 60, over 65, and who have underlying health conditions, chronic cardiac disease, lung disease, diabetes, and the other conditions that we're concerned about with influenza. Pregnant women, perhaps, people have weakened immune systems. These people in these groups really need to pay attention to the guidance about hand washing, not being around ill people, and trying to minimize social interactions at this time to the greatest extent possible. So with that, I'm going to introduce our State Health Officer, Dr. Kathy Lofi.
Well, I'm going to freeze that right there because he just killed the convention industry, folks. That is one heck of a dire statement. He just killed the convention industry for at least the near term. Subscribe to Zenny62 on YouTube.